We are always working to get your questions answered, bring you the most current information. This afternoon, Dr. Alex Garza, Chief Medical Officer for SSM Health and the head of the St. Louis Metropolitan Pandemic Task Force, joins us live to answer questions. Dr. Garza, thank you so much for your time.
Pleasure.
Give us an idea, what are you seeing on the trends in cases in our area? Still heading up? Is the rate of increase lowering?
Yeah, so for the past couple of days, we've actually seen a decrease in the number of cases and the number of hospitalizations, as well as patients in our intensive care units and on ventilators. But, we're always very cautious when we're trying to interpret those changes from day to day. We look more at general trends over longer stretches of time before, we want to draw any conclusions. And we know from our modeling that we're still on that steep part of the curve, and so we always view these things very cautiously when we're looking at that data.
When do you expect that peak to happen? Are we still talking maybe 2 to 3 more weeks?
Yeah, still looking at anywhere from 2 to 3 weeks. It's really difficult to pin the exact date down, and that's because our models change as we get more data into them. So we'll rerun them either today or tomorrow to get a little bit more precision on when we believe that peak is going to occur. But the latest data that we have still puts it at around 2 to 3 weeks.
In just the last hour, President Trump indicated to reporters that there are no issues with the supply of testing, with PPE, masks, beds, ventilators. Is that now true for us here in the St. Louis region?
Well, I think St. Louis is reflective of the rest of the country. We're still operating under crisis standards, which means we're conserving our personal protective equipment. We continue to order personal protective equipment for our employees. The testing still remains a challenge, so we're able to test all of the clinical patients that we have, but testing for epidemiologic surveillance is still a challenge.
Well, speaking of testing, the president also said today that we don't need to test that many people. If you had your choice, how much of our population in the St. Louis region would be tested?
Well, I mean, theoretically, we would test everybody, but recognizing that that's not an option. We're in a weird place right now where there's significant spread in the community, and what you would really like to do is to start testing people early on so you can isolate those that are infected. So we're at this inflection point almost right now where we're trying to see how much testing do we really need to be doing in the community. Of course, more is better. But if you're looking at it from a surveillance perspective, there might be some other options out there. So we're doing the best with what we can, but of course more is always better.
SSM Health St. Mary's Hospital telling us today they have discharged 52 patients alone who had COVID-19. Very encouraging news there. It's a question we get every day via email and phone call from our viewers. Where are we in getting figures on the total number of people in our area who have recovered from COVID-19?
Yeah, so as you've seen on our daily press briefings, we're giving now numbers that are discharged on a daily basis. And so we're starting to collect that data on how many total have been discharged. And so working with the other major healthcare providers in the area, BJC, Mercy, St. Luke's, and SSM, to come up with some of that data. So we think we'll have something to share probably early next week.
In particular, in the city of St. Louis, they have kept the race of COVID-19 victims a secret from the public, despite other municipalities we have seen across the country releasing that sort of information. Now, we've now learned all the victims, though, in St. Louis, and the majority of the positive tests in the county are African Americans. Do you think, Dr. Garza, it's a good idea for our local governments to keep that information secret from the public as far as a public health care awareness practice?
Well, I think it's important for us to understand what the populations at risk are, and so as I've spoken to before, the increase in proportionality of African Americans is really a socioeconomic question, and so these populations that live in difficult environments that have had social inequities are going to be more predisposed to poor outcomes with the virus, much as they are with other diseases. And so anything that we can do to identify those groups and to help correct some of those social inequities is an important thing.
based on the data you see combined with your extensive medical background, when exactly, Dr. Garza, is the soonest that you would suggest the St. Louis region could begin easing our stay-at-home regulations?
Yeah, that's a great question and one that I'm asked frequently. And so the answer that I always give is it depends. So we don't like to make projections based early on in the pandemic. So we want to be able to get through this surge, see what the numbers look like, and then start talking about when could we start easing restrictions. And the reason for that is there's ample evidence to show if you ease up on restrictions too soon, that you can develop a second wave, which could actually be worse than the first wave. And that's something nobody wants to happen.
Can you give some sort of ballpark idea? Are we talking June, July, August? Are we into the fall with this?
Yeah, I think the answer would be yes.
Yes to all of those. All right. We'll take that for what it is.
Yeah.
Dr. Garza, thank you so much for your time this afternoon. We appreciate you making the time available to us. Well, as